So I thank you all for coming. And as I said, 9:30 is kind of off step around here, so you'll be surprised. The other members will come in and go, oh, my goodness, I missed a half hour of this. But we're going to be hearing H.R. 3582, the Fair Home Health Care Act, which provides home health care workers with minimum labor protections under the Fair Labor Standards Act. I introduced this legislation in response to a recent Supreme Court decision, Long Island Care at Home Limited versus Evelyn Koch, where the court found that Evelyn Koch was not entitled to the minimum protections of FLSA, particularly overtime pay. Senator Harkin has introduced a companion bill in the Senate that is exactly like this bill. Evelyn Koch, who unfortunately could not be with us today, worked as a home health care worker for Long Island Care at Home for a for-profit home health care agency for 20 years. Home health care was her vocation, and she worked an average of 42 hours a week caring for the elderly and the disabled. Sometimes she was required to work 24-hour shifts, but she was not paid overtime during her 2 decades of work. The Supreme Court found that Ms. Koch fell into a narrow exemption created by Congress in 1974. Ironically, when Congress created the exemption, it did so in the context of expanding FLSA. They were expanding it to cover most domestic workers, such as chauffeurs and housekeepers, who previously had no labor protections. The congressional record from that period shows that Congress did not mean to exclude home health care workers, but only those workers who provided ad hoc services for the elderly and disabled, only for workers who were, quote, babysitters. So it was a mistake, and it needs to be corrected. Nonetheless, the court found that Congress's intent was not clear and that it meant to delegate the details of the exemption to the Department of Labor. And it upheld a Department of Labor regulation that exempted caregivers who worked for third parties from FLSA protections. So I suppose we could argue whether the Supreme Court's decision was technically correct, but I do know that it was bad policy, absolutely. And if it's allowed to stand, it continues the exploitation of a segment of America's workforce, mostly made up of women and minorities, a segment that does really important and difficult work and barely making a livable wage. Moreover, there is nothing in the decision that acknowledged what most of us know, that home health care has changed drastically since 1974, when caregiving was largely provided by family and friends. Today, about 2.4 million workers are employed by nursing homes, home health care agencies, assisted living, and other residential facilities. Over 800,000 of these workers provide in-home care. As the baby boomers age, this need is going to grow hugely. According to one estimate, in year 2000, 13 million elderly needed caregiver services. By 2050, this number will grow to 27 million, from 13 to 27 million. And the disabled population needing care is also going to grow during this period from 5 to 8 million. And I doubt very much that they've taken into consideration the returning wounded Iraqi vets when they come up with that number. So today already there is a shortage of home health care workers. Turnover is very, very high, and nearly 1/2 of the home health care workers leave their jobs each year. So this in turn impacts the quality of care for people, and in many cases disrupts their care to the point where they are unable to stay at home. And the main culprit is low pay. The average home health care worker makes less than $10 an hour, about half of what other workers earn. More than 20% of home health care workers actually live in poverty themselves, and need public assistance just to make ends meet. I mean, that is just unacceptable. And oftentimes, they do not have the work benefits that most of us rely on, such as health care, vacation, and sick time. This work is difficult, it's taxing both physically and emotionally, and must be honored. So I know that there are those who worry that if we pay home health care workers a decent wage, the disabled will not be able to afford in-home care. And I know that there are others who say that Medicaid and Medicare costs will soar, which will ultimately mean a huge cutback, well, a cutback in services for those who need it the most. But in some states, such as Michigan and Minnesota, they already pay overtime to home health care workers, and certainly the sky has not fallen in those states. It's working. Those states recognize that it is simply morally reprehensible to exclude hardworking home health care workers from minimum labor protections. They also recognize that these protections help to stabilize the workforce. So H.R. 3582, the Fair Home Health Care Act, restoring minimum wage labor protections, will be debated today. We will have the hearing. We will ask you questions. But I want to make sure everybody knows that this bill does not cover occasional caregivers. It doesn't reach live-in caregivers either, because they're already exempted from overtime, but not minimum wages. It simply ensures that home health care workers are paid what they deserve. So I look forward to exploring the issues with you and hearing your presentations, and I honor you for being here.